Like many of my patients, Tom suffers some urinary difficulties, and over time he ended up needing care, and he actually had some procedure done somewhere else and ended up coming here for further care. Can you tell us what happened before your surgery? What were you experiencing, Tom?
Well, I was having difficulties urinating, and basically that's it.
And Donna, what did you experience when Tom was having difficulties with his urination?
Oh, we had to stop every 15 minutes to find a bathroom, and then he said he'd start and stop, and he'd come out of there, and then 15 minutes he'd be in there again. And then he had loads of UTIs, one after another, every other week just about for a while.
So it's always interesting whenever I have the spouse here, I hear a different side of the story. Tom will say, I just have some trouble urinating. But then Donna says, well, this is exactly what he was experiencing. Okay, so what eventually led to you getting care by another urologist? You had a procedure done. What happened then?
Well, I had a UroLift done, and it kind of worked for a while, but then I started getting these urinary tract infections. Must have had like 6 of them in 6 months. So, something had to be done there. It was being on those antibiotics all the time. And so this procedure has cleared it up. I haven't had one since, and it's been like 4 months. So.
Okay, so let's talk about what happened. So you had trouble urinating, you had a UroLift done somewhere else. It worked a little bit, and then all of a sudden you started getting a lot of bladder infections, most likely because you're not emptying your bladder.
Yeah.
Okay. And Donna, what did you see Tom go through after his UroLift procedure?
Actually, it was, after his UroLift.
Yeah.
I didn't really think it did that much, to be honest with you. And I said, he was still in and out of the bathroom quite a bit. And I said, gee, I thought this was supposed to eliminate that. But at least now he's good.
Yeah.
Thanks to you, Dr. Lynn.
Well, so you ended up getting a lot of UTIs despite the UroLift after that worked a little bit. And then what led you to come here to seek additional care?
Well, I knew something had to be done. I was just, I couldn't live with that. It was just not good. Not happy about being on that many antibiotics all the time practically. So
Sounds like your bladder infections were really bothering you.
yeah, they just, it's one of those things you'd rather not have for sure.
Yeah, for sure. And then I did some workup on you, looked into your bladder, measured your prostate volume, and then we decided to do a surgery. What kind of surgery was that, and how was your experience?
Well, I was very pleased with the surgery. Everything went very well, and I only had some issues because I'm on blood thinners, but other than that, I was very impressed with the whole thing. It went very well.
Donna, what did he go through after his surgery and circumstances around his TURP surgery?
He did well. A lot better than I expected because he's 84 years old. So I think he did very well, other than a couple days of a burning sensation. That was it. And the bleeding was tough because he's on blood thinners, but that, after a while, lightened up, and here we are 4 months later, and he's doing great.
Sounds like an uneventful recovery. So what have you experienced since recovering from the TURP procedure?
Well, I just feel like I'm normal. And my urinary, I'm very pleased with the results, and particularly at my age too. So I'm happy about it.
Great. Now, Donna, you mentioned multiple times that he had to pee a lot.
Yes.
Get up multiple times a night.
Oh gosh.
How has this changed after his TURP surgery?
Oh my God. It's great. Unless he drank too much coffee and like that, but it's great. He's what I say. He goes a couple hours without in and out of the bathroom. We'd have to go to a grocery store or something. He'd have to find a bathroom. He'd pee before he left, and then he'd have to find a bathroom as soon as we got there. Now we don't have to do any of that.
Sounds like he's really curbed his frequency of urination, and sounds like it's improved his quality of life.
Oh yeah.
Absolutely, mine too.
So how has that improved your quality of life?
Well, I felt bad for him because no matter where we went, he had to find a bathroom or, and it wasn't easy all the time, I mean, you didn't always have easy access, especially when you're in a car driving somewhere. So
Yeah.
now we don't have to worry about that.
Yeah. And Tom, what did you feel?
Yeah, it's very pleased that I kind of feel normal again.
That is great to hear. Now, I have a lot of guys who are hesitant to undergo any sort of evaluation and treatment for his enlarged prostate and urination issues. What will you tell those men?
Well, I think the whole procedure is very easy. Surprising to me how well it went. I had my apprehensions in the beginning, but as I went through, everything here you need. I went through some things I never imagined that they could do, and very pleased with the results. I'd recommend anyone come here.
Okay, well that's the bottom line, to get evaluated. I think that's the main
right.
thing.
It's important to, when in doubt, check it out. They have everything here you need, and I always felt comfortable. That there was no need to go anywhere else. It was all here, and very pleased with my results.
So you heard it from Tom. When in doubt, check it out. So thank you so much for sharing your story.
Yeah, you're welcome. It was a pleasure.
And thanks for sharing your perspective, Donna.
Oh, thank you. Thank you for making him a easier man to live with.
It's very important to hear from the spouse's perspective sometimes too.
Well, absolutely, because my memory's not what it used to be, and she's observing all this.
You
So
bet.
it takes both of us to really see what the whole picture is.
And I always say that whenever a patient comes in, if there's a spouse or someone to advocate on your behalf, the patient gets better care, no matter if it's in the clinic or in the hospital. So thank you so much, Tom, for sharing your story.
You're welcome.